Okay, good afternoon, everyone. Thank you so much, whoever has managed to kind of log on to this Zoom meeting and is here. I would like to introduce myself first. I'm Ishita Iyer. I'm a psychotherapist, a clinical hypnotherapist, and a transactional analyst. Arjun is a very dear friend. We've known each other for almost a decade now. We trained for clinical hypnotherapy together, but Dr. Arjun is not just a physician, a medical doctor, but he's a therapist par excellence. He has roamed the entire country, worked with thousands of people from all walks of life. And he's also currently studying Ayurveda, and that is the beauty about him. He's exposed to all kinds of education systems and all kinds of cultures, and with something as potent as addiction, which is so prevalent today, and we see this more and more in children. I thought it would be nice to have him. The last session that we had some technical glitches, but people managed to watch the YouTube video, and we had a, a load of questions, and that made me think that maybe I can do another one with Arjun, and he can give a little more explanation on a couple of more questions that we have received. So, we're not going to keep this in like a webinar format, because obviously we understand that, a lot of people are already fatigued with going online so much. So it's going to be very simple, very interactive. And, but before we begin, I had a question last time from, a mother who's also a preschool teacher, asking if, asking for some more solutions. Now, what we need to understand is addiction is not the root cause of a problem. And, Arjun will definitely explain this, because the first question that we have is, what is the definition of addiction? So addiction is the result of something. It's not the root cause. So it's very important that you understand the scientific or the explanation part of this, in order for you and for you to help yourself and your loved one to kind of battle addiction. So Arjun, with question one, I would like to hand it over to you. And the first question is, what is addiction?
There are a lot of clinical scientific definitions of addiction. However, the one that I choose to operate with is something which has served my purpose of being a better therapist when it comes to addiction. And this definition is what I like and what I employ about addiction. So, when any stimulus is utilized by a resting brain, such a state which has a negative impact can be called addiction. So what, a bunch of words here, but what it essentially means here is our brain is throwing stimulus, our brain is constantly active, and there are loops of electrical activity which happen in our brain. And when a substance or when a stimulus, when it could be food, it could be screen, it could be sex, it could be coffee, it could be drugs, it could be sleep. So there are like bunch of things which gets placed in the loop of electrical impulses which is happening in brain. And when this impulse starts to affect a person negatively, such a behavior is called as addiction.
All right. Thank you so much. So the next question is addiction really an escape from reality in children, or are they really trying to escape emotions? Because these are things that people are reading so many articles today. A lot of things and information is also floating around. So this was a query from a father who asked, is it really an escape from reality that my child does not want to face emotions, and that's why he's glued to his mobile phone? And this particular father has his son downloading one game after the other and not finishing any of those games.
So I have to talk to the father. It's an interesting father who is figuring that out. Someday maybe I will, but uh, no, it is not. See, what is like whenever we use the words like escape mechanism or things like that, these are two vague words. It's like imagine somebody does not want to have a conversation, so they take off. That is escaping. Like when there is a confrontation happening, somebody don't want to face it, so they leave. So that's escaping. Now, when it comes to a child, this child is purely bold with what is being presented to the child. So the child is enticing itself with new games. And this is being made available to the child by the parent. So escape mechanism, I think, is by the parent because they don't want to deal with the child. They're giving the mobile phone to the child and allowing the child to play so many games. This is definitely not, if there is anything called escape mechanism, I don't see that happening in the child here. The child is just having fun. The child is doing what the child is supposed to be doing in the given set of equations that is presented around.
Right. Okay. So the next question is from a preschool teacher. And this is specifically pertaining to the lockdown situation that is on in Mumbai. So the question is, we have to keep online classes for 3 to 6 year olds for 40 minutes since we have too many inquiries on how to keep children occupied during lockdown, since even we as parents are working from home. What is the way out, and how do we make sure that the child is not impacted as much post the lockdown is lifted?
I didn't get the part where is she trying to say that she's both a teacher and a parent who is
Yes,
working
she
from
is.
home?
Yes.
Okay, wonderful. So there, very recently there is a very beautiful Montessori in Bangalore called Sanskriti Montessori. They're one of the top listed Montessoris in Bangalore, and the trainer there is actually doing this for a lot of children. And she's doing a very good job. Her name is Sunita. So when she was telling me this, I just realized there is a whole beautiful science behind how to engage with children. And if that subject is not understood, like there's a lot of backwork which happens. But let me briefly mention what is to be done here. See, the child has, there are few things which must be very carefully understood. The child has short attention span. The
So
child,
how short do you mean when you say short? How
it
short is
depends
short?
from one child to another child. We can never fixate. So it can be anywhere from 3 seconds to 1 minute. And if any child has attention more than 3 minutes, the child needs psychiatric evaluation. It's like it needs to be evaluated appropriately. Child cannot focus on one topic for so long. It cannot happen. It's impossible.
Right.
It's very difficult for a child. So if the child is to be engaged on screen, we have to ensure that the equipments with the child is going to be utilizing is similar both in the home and in the preschool. The person who is actually dealing with the preschool should at least be with the child should be aware what are the equipment. Like say right now I'm holding a pen, so at least the teacher should utilize some toys which the child is familiar with. So child
Right.
actually interacts by knowing familiarity. So that's familiarity and short attention span. And there are a few things. Um, if this person could contact me or you eventually, we could arrange for them a meeting with people who are doing this effectively. They
Okay,
are
so
actually taking
then,
yoga also.
okay, so that is another question. That's the next question that I have, definitely. But in this lockdown situation, how do we find that balance where we have no choice but to teach those children online? Yet there is, I think, also there's a conscious guilt that a lot of these teachers have, that I have to teach online for X number of minutes or hours, knowing that it's not absolutely right, but there's no other go in terms of teaching online right now. So
See,
how do you manage that?
no, it would be improper to say that it is not right to teach online. I would suggest first we have to accept the fact that we are entering into a world where the digital screen is going to be the new teacher. So
Hmm.
there is something called Khan Academy. You can look it up. I mean, our viewers also can look it up, where there are programs which has built from 2-year-olds above. So a
Okay.
wonderful work is actually happening where how to teach different age groups, how to teach phonetics, how to teach language, how to teach numbers. Everything is very beautifully explained there. So, and some of the content are free too. So I would recommend all the preschool teachers to look up these content from, especially from Khan Academy, or they can get in touch with us where we could, put in touch with appropriate people who have uh, built modules. Quite often, one of the things which we see with children is put a child on a screen. The child does not want to sit in, in front of a screen because the real world is much more fun. However, what's happening today is that this particular mobile screen has so much of fun stuff. This mobile has, music, it has cartoons.
Quite
So the child,
enticing.
yes. So now
Yeah.
from that enticing world, the child is now shifted into looking at a face of a person, a human being, sometimes who is in really good mood. And when such a thing happens, did you lose me there?
Yes, I did. I
Hello?
got you.
Yeah. So if the child is bored by looking at the same kind of data on the screen, which is one human's face, without actually engaging the child, that's where the problem happens. This um, my suggestion: go through Khan Academy stuff or get in touch with us so that we can help them build
Right.
better modules for their
Right.
children. Yeah.
Right. So the next question is, are only parents responsible for screen addiction? Considering children go to school, they're exposed to other children. So is it only parents that are responsible, or are there many other factors involved?
See, the moment we take this question as responsibility of a single individual or couple of individuals like parents, teachers, this becomes a blame game.
Right.
So I
Right.
refuse to say that this is only a parent's responsibility, this is only teacher's responsibility, or this is somebody in the institution, their responsibility. This is collective responsibility. Like, this is my responsibility, this is your responsibility. Every time you see a parent indulging in practice of giving screen to a child so that they don't want to deal with the tantrum of the child,
Yeah.
we have to be there to tell them. We have to tell the parent, don't do that. what you're doing is going to be devastating. It has a negative impact on the child. We should be able to actually do that. And it's everybody's responsibility. See, let's say you're on a local train, or you're on a, there's metros, you're sitting in a bus, and you see a parent handing over the phone, and the child is kind of playing with it. It's our duty to actually tell parents what happens during this moment.
Right.
So it is everybody's responsibility. And if the child is already addicted, my request is, please reach out, before it is too late.
So how do you know, how can you tell that, what, this child is addicted to the screen? What are the parameters that tell you, like for you, for someone who is probably a layman who does not come from psychology or a medical background, how do you tell that that child is addicted? Of course, there are obvious symptoms of being on it for long hours, but what are the other parameters or symptoms, if I should put it that way, that one can look for, that they can actually go and seek help instead of trying to battle it on their own?
So I would like to mention, how do we recognize alcohol addiction? Okay, so we have something called, there is a parameter set for that. So the
Right.
first one is, it's called as waking up dose. So a person actually wakes up and has to drink to,
Right.
it's called as morning dose. So
Right.
that's one of the first signs of alcohol addiction. So if you don't give the morning dose, the person has a bad mood throughout the day. So so that's one. And second, the productivity is reduced.
Right.
So there are numerous criteria, but I would say take a couple of something similar to child. This is still under the process of being built, and even if somebody has built, it has not been culturally globally accepted. But
Right.
my suggestion would be, first, if your child wakes up and asks for mobile phone, yes, your child is addicted. And if your child
Right.
yeah, I know, if your child wants to eat, study, play with only mobile phone, yes, definitely your child is addicted. And second one, third one, if your child is throwing tantrums, if your child is having fits of rage, when you don't give the object of addiction, yes, it is addiction. Yes, it is addiction. And fourth one, if the child is refusing to be human, communicate, hug, act like a child, and trying to connect more with mobile phone, yes, your child is addicted.
Right.
And fifth one, when new people, guests, strangers, teachers, if the child chooses to interact with more with mobile phone than with real new people, friends, make friends, play out there in the ground. If the child chooses to play with the mobile phone, I wouldn't say ground in this COVID times. I would say at least with something, in the physical activity. If the child refuses to do physical activity, 50%
Right.
plays with mobile phone, yes, your child is addicted. So if you find these criteria, I would suggest that
Get
this
professional
is
help.
in the uh, get help with someone who is really good in the subject. And yeah, get help soon. Get help
All
soon.
right.
And more than the child, I would say, like in years of working with children, parents need help. If parents have pushed the child to be there, a lot of parents don't face this reality, and I want to tell this here: parents need help. The child does not need help
You
here.
need to shout that out loud repeatedly,
Yeah,
because
yeah, yeah.
that is something that that needs to be highlighted, scream from top of the mountain at this point in time. So now this brings us to a very, very interesting question, again from a mother, who's also another teacher, that when, let's say, both parents are frustrated, the mother's frustrated with looking after her house, and today when even women are working, so the mother's trying to balance home and work together. um, and the father is also, going through work stress or work pressure. There's anxiety and depression roaming in the house. How do we manage a child at that point in time? Because out of that frustration, it's just like a vicious loop. So how do we kind of manage that? Arjun, if you could share a bit on that.
Yeah. Palak just mentioned something really beautiful. The 5 points which I mentioned are the addiction criteria for everyone. Like even
Yeah.
if adults have those criteria, that is that's how we actually recognize these five
Right.
criteria are the ways in which we recognize addiction. And
Right.
thank you, Palak, for mentioning that. And let me answer this question. If parents are battling depression, battling anxiety, and if they are not fixed, I would suggest change your doctor, change your therapist.
Or go get one.
It's or go get one. So people are very kind when they use the words like I'm depressed, I have anxiety. These are all clinical terminologies.
Terms. Yeah.
Don't use those
Absolutely. Don't
terminologies.
don't float them around. Yes.
Yeah, don't use those terminologies. Don't label yourself. And if let us assume you're too kind on yourself and you choose to label yourself with such terminologies, get it confirmed with someone who can actually treat you for that. Like if you are being treated for something and if it's not working, change the therapist. See, when you don't like a hotel, you change hotel. But if you don't like the medicine, if your medicine that you're taking is not giving you results, what's stopping you from changing the therapist? What's stopping you from changing the doctor? It's people are very they blame the doctor. No, this is not the problem of the doctor. But quite often what happens is um, they have not invested in what the doctor or the therapist have told, or the doctor or the therapist has not managed to get the right leverage because they're friends. So quite often this is what I've seen. When we treat patients as friends, therapies don't work. It's really. And if parents are battling anxiety, like this is a question where this has nothing to do with the child is actually trying to relive itself from
Right.
somebody who is acting abnormal. And the only solace for the child is mobile phone.
So yeah, the child is actually trying to parent the parent.
The child
Is
is
it?
protecting itself. Whatever. The child is protecting itself. So if parent is suffering from anxiety and depression, um, please get help. There are really, my suggestion is there are really good therapists all around. Like probably years ago, there were very few, but
Yeah.
today we see that there are really accomplished people who can actually help. And if you still don't find any such help, please shoot us questions. Maybe we won't be able to reach out to you directly, but we will be able to do some
Yeah.
small
We'll
videos that
definitely, yes, absolutely.
we will definitely reach out. But let's not make the parental problem the problem of the next generation.
That was beautiful. That was beautifully said,
Yeah,
Arjun. Thank
yeah,
you so much. Okay,
yeah.
so the last question that I have is, again, pertaining to the lockdown situation at this point, largely. So the child, when the parent tells the child, why should I stop using the screen because you are also working online, you are also using so much, so I'm just kind of doing what you are doing. So when there's such an answer, which is I find quite intelligent on the part of the child as well, how do you cope, or how do you tell the child that you are a child, I'm an adult, or how do you explain to that child that the amount of time you're spending watching cartoons, or and in the last episode you spoke something really beautiful about cartoons and all of that. uh, so how do you manage this situation now?
See, one of the fundamental mistakes which lot of parents do is tell the child, "You're a child, I'm an adult."
And I think that's
Now,
very, very prevalent in India, especially. I've found that.
this has nothing to do. Let's not make a geographical
Right.
generalization.
I
It's
apologize.
no, 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 no. Sorry, no, no. I didn't mean that. No, but what I'm saying is, it's a it's a psyche which used to be prevalent, where an adult is separated from a child um, for a very long time for many reasons. But today, because of the presence of media, child is from a very young age exposed to almost everything that the parent probably was not exposed till 18 years or 20 years.
Right.
So child has seen more movies, child has seen more intimate action on screen uh, than the parent had access to. So, you know, making up judgments, thank you, Sneha, and making up judgments that, the parent has to do something and the child has to listen to parent is one of the, uh, I would say, it's a computational error in communication between child and parent. It's a
Right.
it's it the commands don't pass through clearly if such a practice is employed. It wouldn't happen. So we have to look at this whole thing from a completely different perspective. Thank you, Navya. And we have to look at it from a completely different perspective. The parent must talk to the child. That's it. When a parent talks to a child, now this is where I love this guy. There's a book by one guy by name Gary Chapman, Five Languages of Love, and he talks of something.
Can you just type it out in the chat towards the end of the meeting so everyone can know about it?
It's Five Languages of Love by Gary Chapman. Yeah.
Okay.
So
Right.
yeah, so by Dr. Gary Chapman, and brilliant, brilliant book. And there he talks of something called as quality time. So this is one of the key ingredient for child-parent relationship. Whenever a parent is interacting with a child, the parent has to give 100% attention to the child. This happens when the child is about 6 months, 1 year. However, when the child grows up, when the child is, probably walking around 3 years, 4 years, a lot of parents stop giving 100% attention to the child. Now the child is confused. I used to get 100% attention, and all of a sudden this has stopped. So what can I do in order to get my parents' attention? And instantly, the child tries to do what the parent is doing. This is not imitational learning. So there is something called imitational learning. It's a phase in child development where during 6 months of age, if you notice, when a parent eats, the child also chews. So that's imitational learning. But this is it has added a lot more strategies. So where the child is deliberately pushing into the time what the parent is doing, and that's because parent has not given the child the adequate time. So
Right.
whenever, like, my suggestion to any parent listening to this is, please take 20 minutes and with 100% attention, keep the mobile phone away, keep everything away, talk to your child, hug your child, hold your child, look into your child's eyes, connect with your child. Trust me, if you don't do that, somebody else out there is going to do that. And the child will think that's love. And you lost a child.
What if they're not willing to do is the question. Someone has just asked that question.
Give more time. Give more time.
Chetna.
Give more time. Give more
Right.
time.
Can this
Take time.
be done to, let's say, toddlers in preschool as well? Or would that
Yes, it
not
can be
be
done. It
appropriate?
can be done till
It
any
can be done.
age group. it can be done to
All right.
any age group.
Okay. So I think in the previous one that we did, you mentioned about yoga and meditation for combating or helping someone battle the fatigue that comes with addiction of the screen. Can you share something a little more on that, or is there any particular kind of technique or yoga or breath work or whatever it is that one can use to help them balance out this situation, especially during the lockdown at this point?
Okay, so yes, definitely. See, fibromyalgia, fatigues, and it doesn't matter what kind of fatigue. But screen fatigue is, it's just another terminology for me. Somebody who is sitting in front of screen is choosing to, be screen fatigue or whatever. But there are certain breathing techniques which are extremely effective when it comes to these fatigue syndromes. So the easiest one is, take a deep breath, breathe in, and as you breathe out, you chant e, any syllable. It can be namaz, it can be any chants,
Yeah.
om, doesn't really matter. Allahu Akbar, om, does not really matter. But take a deep breath, breathe in completely, and as you breathe out, chant this. So what happens here is, um, when a person chants something, this is actually, one, the breathe out phase tends to become stronger and longer. So the breath out is regulating parasympathetic system. So parasympathetic system, which is weakened because of many reasons, starts to get activated. So that is one of the simplest ways for dealing with fatigue. And I think you asked me one more question regarding the eye, and is there anything
The
that we
dry eye
can do?
syndrome. Yeah.
So if a person is already facing something called as dry eye syndrome, my suggestion is you might have to go for clear-in or teardrops. It's artificial cellulose which is put in the eye so that your eye doesn't go dry. But apart from that, if you're not in dry eye syndrome, so the best way is just apply gentle pressure on the eye. Don't rub them, but just apply gentle pressure, and keep with your palms slightly placed, look left, right, up, down. So what happens is when the eyeball moves, so there is a small amount of pressure which is being applied. So what this does is it gives eyes like a slight kind of a massage. Do it for about 30 seconds to 1 minute, and also rotate the eye in all directions, move the eye up and down, and all these eye exercises, it's like they are very helpful. And if you can time it, like if somebody is using screen for a very long time, maybe every 45 minutes, just put an alarm on your phone, and every time the alarm rings, hits off. So all you have to do is just for a minute or so, keep the eyes closed, keep the palm, move up and down, and then keep rotating your eyes. So you're giving eye some rest.
Right.
So that's one very easy way.
And one last question I've just received on WhatsApp is the last question before we take any question if any of our viewers have, is I think you partially answered this, but if my child is doing nothing the whole day and is still extremely tired and lethargic, is that a sign of fatigue? Or is that a sign of another underlying problem?
See, one of the key things which I'm seeing in my clinical practice is there are a lot of children who are nutritionally deficient. So what's happening is,
mental
so
health
yes,
and
so what's happening?
nutrition.
Yeah. So what's happening is there are a lot of children who don't have micro minerals in their food. So all, I wouldn't say all, at least most of the parental population today have received good nutrition in their childhood, because we used to get the food which used to come from fields in the neighboring villages, and it used to somehow reach to the towns where we are, and then we used to get access to that food. But the children today, they are being fed the food that's grown with just urea, with just a lot of NPK fertilizers. So the yield is really high. The fruits look really big. However, they don't have microminerals. And this is like I had a child, um, which I'm seeing from last 1 year. The child is about 7 years of age, and the child could not speak with fluency for a very long time. And the only thing which I did for the child was I put the child on multi-mineral syrup. And in about 6 months, the child's comprehension increased up to 3 to 4 words. A 7-year-old child. Yes. So that's when but of course, the child had physical traits that had of nutritional deficiency. What's really surprising is the parents could not recognize it. They're educated parents, and they couldn't recognize that. And they just kept thinking that the child is slow, the child has certain syndromes. And sometimes when they go to certain medical practitioners, they get so many opinions that your child is normal. And sometimes they get that, okay, your child might have learning disability, take it to another institution where they're given speech and hearing therapy, but no development happens. So it's a so vast field. I'm not able to say that unless I see the case. Probably I won't be able to pinpoint and say, okay, this is where the error is. However, um, I want to believe this. I'm not saying it's possible, but I want to believe this, that at least 50 to 70% of the children, if we can intervene appropriately with nutrition, with right learning strategies, we can make a difference in their lives. We don't have to allow them to suffer for the rest of their lives.
Right.
So, yeah.
Wow. I think this is another session that we can have all together. So I would, I would just want to add some, do you have some closing notes? But before we have a closing note, does anyone have a question that they would like to ask Arjun right here? Or we can kind of, after we post this on YouTube, maybe then you can kind of ask us a question. But if you have any questions, please feel free to ask us. Not, we can close.
Well, since we have a few minutes, the learning strategies are really well defined in advanced behavioral techniques today. So there is something called behavioral therapy and behavioral analytics. It's fairly I wouldn't say a new field, but extremely scientific field. So my recommendation is find out if there is a behavioral therapist nearby. Find out if there is a ABA therapist nearby, and get in touch with them if you see any signs of learning disability, because they have well-built modules which can help a child.
Okay.
Yeah.
All right. Thank you so much, Arjun, once again for taking time out. Even though you in another part of the country
I just
right
got,
now. Okay, so
I just got one.
Asked a question.
Yeah. I think. What was that?
Yeah. So I'll just ask. Are there any obvious signs? Yeah.
Yeah. So one of the obvious signs is the child has less body weight for the age. The body structure is shorter, and the child has less body weight. That's one of the signs. And Second sign is the color of the hair, even though not permed, is different. It's slightly yellowish, or it has a different texture to it, to the color of the hair. And the third one is the child uh, does not the child sleeps almost anywhere and everywhere. It's like it's extremely tired. I would not want to use the word fatigue, because like it becomes little more. The child is tired. So you keep a child, make a child sit anywhere. In some time, the child starts to sleep. So that's one more sign. And the child has difficulty in learning anything really fast. So the child feels, okay, I'm like the parent feels the child is not able to retain what has been taught to the child. Here there can be a couple of things. I would want to say this is like the last factor, because the inability to retain could be because of the lack of teaching and learning strategies, which parents are not aware of. But despite having the appropriate strategies as employed in really good techniques, despite employing them, if the child is not learning, then we could say the child has nutritional deficiency. Yeah.
Okay. Thank you so much, Arjun. We'll close it there. Thank you so much for answering all these questions in detail. We went a lot more in depth this time than we did last time, and I'm sure we'll have more questions. But once again, thank you so much. I'll definitely be having you again with a different topic, because I've got a lot of ideas from the current discussion that we have. And until then, everyone just stay happy, stay safe.
Yeah, thank you, Ishita. Thank you for having me here. And my suggestion to everybody is, please watch the previous video. Please watch the one which
Yes.
has a lot of underlying basics on the child development before you understand some of the topics here.
Yes.
They kind of
Yes.
overlap. So thank you
If
so
you need the
much.
link,
Thank
get
you,
in touch
Ishita.
with either of us. If I will be posting this on YouTube, you can watch it again, you can share it. But if you need the link for the previous episode, you can get it from me or Arjun, or it's on our Facebook profile, so you can get it from there. And in case you still can't find it, Live Inspired with Ishita Iyer is the name of my Facebook page. I'll be loading it up there, so you can take it from there. Thank you so much. Good evening, everyone. Thank
Thank
you.
you so much.